Lung cancer is a cancer that arises primarily in the lung, and sometimes it can spread to other sites. It's the third commonest cancer in both women and men in Australia, but it is the leading cause of cancer mortality. The main risk factor for lung cancer is tobacco smoking, and this is responsible for approximately 90% of lung cancers in men and 65% in women. Other risk factors for lung cancer include environmental tobacco smoke, occupational exposures such as asbestos, and also underlying chronic lung disease. However, it is important to remember that lung cancer can also occur in non-smokers. There are several signs and symptoms that health professionals must consider in patients who might have lung cancer. Patients with lung cancer can present with cough, shortness of breath, and recurrent chest infections. Now, these symptoms commonly occur in those with chronic underlying lung disease, but if the symptom is new or changed in any way, or persistent for over 3 weeks despite common treatments with antibiotics and inhalers, then this may be a cause for concern. Patients with more advanced lung cancers can also have loss of appetite and unexplained weight loss. It is also important to remember that if these symptoms occur in non-smokers, that the diagnosis of lung cancer must also be considered. A rapid referral to a specialist is important for timely diagnosis and management. Lung cancer has been documented to progress in as short a time frame as a month, and sometimes patients can go from being curable to incurable. If GPs suspect that they have a patient with lung cancer, they should follow the Cancer Australia guidelines for GPs in terms of managing this. Usually the patient requires some form of chest imaging, and then if this is suggestive of lung cancer, they should be referred to a clinician, usually a respiratory physician, who is a member of a lung cancer multidisciplinary team. A multidisciplinary team is a team of clinicians from different specialties who in this case would all manage lung cancer. They meet on a regular basis to present patient cases, go through the relevant imaging, have a look at the pathology, and then make a consensus recommendation of treatment. The benefit of this is that patients are able to get multi-specialty input into their treatment recommendation without necessarily having to see each individual specialist in turn. Patients with lung cancer should be referred to a multidisciplinary team to ensure that they receive evidence-based guideline care. Being discussed in a multidisciplinary team will also ensure timely access to diagnosis and management. This will also provide the appropriate psychosocial referrals necessary to help patients cope with their treatment. GPs and other health professionals can locate lung cancer specialists who are part of a multidisciplinary team at the CanRefer website. The CanRefer website can be searched by location and tumour type so that both health professionals and consumers can locate their nearest lung MDT. As healthcare professionals, we need to diagnose lung cancer early and provide a rapid referral to a specialist associated with a lung cancer MDT to ensure best outcomes for our lung cancer patients.